Doctors of Reddit, what's the biggest case of faking it you've ever seen? Male patient, 18 years old, rolled in unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs. When I hear something interesting, I place the stethoscope near his mouth and hear him breathe in normally, but then breathe out by saying breathe. No joke. Male patient, 21 years old, admitted with inability to speak for last 2 hours and respiratory distress. Lungs clear, but we hook him up to oxygen for a few minutes. After he's taken off, his father comes running and drags me over, saying his son's tongue refuses to go back in after receiving the oxygen. I look at the kid and he's seriously just lying there with his tongue poking out like a child. I tell them to push it back in. A few hours later the dad tells me the boy is convulsing. I go to see without making my presence known, and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on his back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her, and she is literally blowing spit bubbles. I check her reflexes, everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid and the spitting intensifies. Male patient, 30 years old, unconscious and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, ECG, reflexes, pupils, etc. all are normal, I start checking pain sensation. He slowly began to open his eyes and groan as I asked him to tell me his name, but the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, complained of respiratory distress and convulsions. Everything's normal on admission, and she's conscious, but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit, where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, so she was faking an illness. Since she was refusing to eat, the attending wrote up an order for an nasogastric tube, which was inserted and then removed by her in a matter of minutes. Obligatory, not a doctor, I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asks the doctor to check his shoulder, which doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc. How long have you been playing for them? Guy has been playing and training the whole time. Doc puts this info on insurance form. Doc loses his shit in staff room laughing. Next week the patient loses his shit in reception because his insurance has been cancelled. This patient comes in for back pain with weakness of the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. Patient is infuriated that they are being discharged, yelling and screaming about how they aren't better, how they are disappointed in the institution, blah blah blah. They said one particular thing that still clearly stands out 3 to 4 years later. I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home before they even have the chance to see me. My attending and I leave the room to arrange things with the nurses. We go back in, and the patient is out of bed and standing up in the middle of the room. Miraculously the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding abuse of medical services. I'm a nurse, but not a doctor. I had a patient who worked in a hospital, janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, wanting morphine. He was worked up for everything cardiac and was fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything. faked chest pain again. Cleared again. Now he's my patient. I'm a new face. He's telling me he's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomach ache. I decide to go to lunch. My coworker comes into the lunchroom, disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he'd had fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of crap in a puddle of ginger ale. I told him I'd have to take away his food and drinks and we'd have to put an NG down. Suddenly he changed his tune. He admitted to faking it. Taking trauma call during surgery residency, had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with SCIWORA, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week, no improvement. Always had one guard with him. One night they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. Patient last seen sprinting down the road, naked butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard. And she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses. But the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. I'm an ICU and ER nurse. We get a lot of malingering in the ER. One day, one of our frequent flyers came in and started faking a seizure in Tridge. Now obviously I know this lady and she's fake seized 1,000,000 times before. But this time it's in the lobby in front of about 30 people who have no way of knowing that it's fake. She's lolling around on the floor making a damn fool of herself and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing. So she did. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up too, but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever, leave it on the windowsill in my bedroom just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug, and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual Lyme-crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call, but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic with her I'm crippled jet up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. 4th year medical student. On my ER rotation and a trauma came in from a woman that had been arrested. During the drive the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor, didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay, though some of the nurses said that they caught her peeking at us when would leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids, and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. I'm not a doctor but a nurse. There was a geriatric patient taking advantage of the call bell because she was an attention seeker. She always needed really basic things to get done for her because she thought the place was a hotel. It was a rehabilitation ward and we should try to motivate patients to do as much for themselves as possible. She would ring the bell for reasons like please lift the blanket up for me, or please pass me my phone, or please feed me, and claimed that her hands didn't work. I caught her several times lifting herself off the bed with her hands, grabbing her phone when it rang. You get the gist. After days of saying no, and that she needs to start doing things for herself, she grew more and more frustrated. Eventually she snapped, grabbed me by my collar, shook me aggressively and yelled, "What don't you understand about the fact that my hands don't work?" I didn't know what to tell her. I just looked at her and blinked as she slowly released her death grip off me. I guess I healed her hands. Praise the Lord. 1 upvote equals 1 prayer for an old lady's arthritis. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking, tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortless found the YouTube app and typed away in the search bar. Oh, and of course his eyes were back to normal and focused.